Marketplace Open Enrollment Community Meeting. Is anybody here for Medicare? Good, because if you were, you'd be at the wrong meeting. We had that a couple weeks ago. We can still help people, but this is for the ACA Marketplace Open Enrollment Community Meeting. Can you all hear me okay? Mm-hmm. Okay. If you want. Yeah, thank you. My name is Claudia Lennhoff, and I'm the Executive Director of the Champaign County Healthcare Consumers, and we are presenting this meeting, this information. Healthcare Consumers is a nonprofit, community-based organization, and we provide consumer education, advocacy, community organizing, and also free services to individuals who need help with health insurance and any number of other things. So, let's see, just some housekeeping things. Hopefully, everybody should have an agenda and some materials with you. We'll be following the agenda. The restrooms are straight out this door and right across the hallway. Feel free to get up at any time if you need to get more refreshments or you need to go to the restroom. And if you have cell phones, if you can just make sure that the ringer is off, that would be great. I'll do the same. Yes. Okay. And then, so we'll go through the presentations and the materials, and then afterwards, if anybody needs to talk to us directly or schedule an appointment to get help with enrollment, we'll be available, and my colleagues will be available. We are also joined this evening by Health Alliance. And did you want to introduce yourself?
Sure. I'm Martha Adams with Health Alliance. So I've got little flyers from Health Alliance. We represent individual plans along with other plans, employer group, and Medicare. But if you have any specific questions on individual plans, we have a flyer here with a phone number, and we're local, so we're located in Champaign.
Will you be able to answer specific questions on your policies tonight?
If I can answer them, yes. If you have certain.
Okay, great.
Yeah.
Great.
Thank you.
Okay.
It's an easy question.
Yeah. Okay.
I hope.
Yeah, we hope so. Okay, and then my colleagues from Healthcare Consumers are here. Paulette Coleman is over here at the back. Adani Sanchez, Chris Garcia, and then Annalisa Lennhoff. And Adani, Chris, and I will be doing the presentations. Okay, well, let's go ahead and get started with the presentation. Oh, great. Okay, so I'm going to start out by talking about just goals of the Affordable Care Act, just to help remind people. It was implemented in 2010, but the goals are to expand health insurance coverage. At the time that it was implemented or passed, we had over 50 million uninsured Americans, and so the uninsured rate was really, really high. So this was an effort to get to closer to universal coverage. It was also to improve coverage for those who already had health insurance and improve access to and quality of care and help control rising health care costs. I'm not going to go through this in detail, but this is the health reform implementation timeline. When the Affordable Care Act health reform was implemented, it was really in 2010, but that was before the marketplace opened up. But the implementation started by allowing adult dependent coverage up to age 26, and it didn't matter if the young adult was married or in college or anything like that. Parents could add them to their insurance. It removed lifetime caps from health insurance. Health insurance used to sometimes drop people if they had enough expenses and then reached a limit, and then they could no longer ever be insurable again by that insurance company. Some insurance companies would rescind coverage. I've been working at Healthcare Consumers for over 22 years, so before the Affordable Care Act, a lot of the clients we worked with were people who were coming to us because they lost their health insurance because they had started to get cancer treatment. And all of a sudden the insurance company would send them back, the last 3 months worth of premiums and say, good luck. And then at that time, if you had, that was a pre-existing condition, and then it would be very hard to get another insurance policy. So it ensured that people could get covered with pre-existing conditions, children could not be denied if they had pre-existing conditions, etc. And then all the way across to 2014, when there were other big major changes that were made, including the marketplace and expansion of Medicaid and so on. But that's just a little refresher. When we get done, sometime next week, we will have all our materials on our website. We'll send out an email with links to all the materials. So if there's anything that you wish you could go back and look at, you'll be able to have access to it. Okay. There are some benefits and protections as a result of health reform, and these are not just for marketplace plans. These are sort of across the board for health insurance. And some of them we already talked about, like the adult children being able to stay on the parents' policies until age 26. But the other one is making sure that certain preventive services were covered with no copay or no co-insurance. Because the idea was to try to get people into care, and at the very least to try to get them into preventive care because of early diagnosis and treatment, and people can stay healthier, and they didn't want any barriers for people accessing that care. Contraceptive coverage and STI testing, etc., had to be covered, and there were protections. So the protections were really regulating the whole health insurance industry, not just the plans on the marketplace, but all of the health insurance industry. It disallowed insurance companies from having lifetime caps or limits and from dropping coverage, and it said that people with pre-existing conditions cannot be denied insurance or charged more for children and then for adults. And then there's a medical loss ratio that requires that 80 to 85% of the premiums that you pay every month, that those have to go to paying medical claims. So it sort of narrowed the amount of money that insurance companies could spend on marketing or high salaries and things like that. It sort of said you really need to use this money to pay for care. So there's several ways that the Affordable Care Act and the marketplace help make insurance more affordable to people. And Adani will go over this in more detail, but we just wanted you to know, as we're going forward, that there's sort of three main ways. And one of them is to provide financial assistance through the marketplace. You can get a plan from Health Alliance, an individual plan that's not on the marketplace, but you're not going to get the financial assistance that is available through the marketplace. But you just have to make those decisions on your own, and the plans can be a little bit different, so one might appeal to you more than the other. But providing financial assistance through the marketplace comes in the form of advanced premium tax credits to people with certain incomes, and we'll review the incomes in a little bit. But what this means is that you can get advanced premium tax credits that will lower your monthly health insurance premium cost, so that your insurance becomes more affordable. And there's different ways that you can take that benefit, and Adani will talk about it. Another way is providing out-of-pocket cost sharing to people with certain income levels when purchasing certain types of plans, and that can really help increase the value of the plan that you're getting because it will reduce the out-of-pocket costs. And then the other way, the third way, was by allowing states to expand Medicaid, which is public insurance, to people who have lower incomes. And state of Illinois is one of the states that expanded Medicaid. And in this community, that has been amazing because, when you look around this community and you see how many restaurants there are and bars and, gas stations and things like that, grocery stores, a lot of times the people working there don't really make that much money, and their employers don't offer health insurance, and so they could actually qualify for Medicaid, which has no monthly premiums and is very affordable. I think this is where I stop and Adani begins. I apologize for that. That was kind of abrupt.
I was just looking up some numbers.
Okay. Let's get out of your way.
So I'm going to talk a little bit about the health insurance marketplace, and this is kind of where it gets a little deep. So let me know if you have any questions. It is a small enough crowd, so if before we move on or something like that, if you have any questions, you can kind of ask. So we're about to go into it. What you need to know about the marketplace? Oh, say one more time. Okay. What you need to know about the marketplace There are new affordable options available for people without health insurance. All the plans have to cover a set of benefits, so doctor visits, hospitalizations, maternity care, emergency room care, and prescriptions. And there is financial help available for certain income levels. And all the health insurance plans have to show costs in simple language with no fine print. So that is called a summary of benefits. And so it's going to look the same so that you can actually compare the same documents to different plans. And so that was one of the big changes, is forcing those health insurance companies to provide this information in an easy to compare format. People can enroll online through healthcare.gov, over the phone, or using a paper application. You would have to call to get a paper application. Open enrollment is from November 1st to December 15th. So this year it's been shortened from previous years, so it makes it a lot more difficult to get people in on time. For health insurance to start January 1st, 2020, you must enroll by December 15th of 2019. People will find out if they're eligible for Medicaid, premium subsidies, and cost-sharing subsidies through one application. So when you go to healthcare.gov and maybe you don't know if you qualify for Medicaid, there's going to be no wrong door. You're going to apply at healthcare.gov and it's going to say, you might qualify for Medicaid. We're going to send you over to the state of Illinois. So if you don't know, healthcare.gov can be the place to go and they will direct you in what you qualify for. There are special enrollment periods, so if you don't need health insurance right now, or maybe something changes, you have a job, you lost a job, you're having a baby, you're moving to a new zip code, you had a change in your tax household, you're turning 26 and getting off of your parents' health insurance, these are going to be special enrollment periods, so you can get health insurance in the middle of the year outside of this open enrollment period that we're in. The marketplace is for people who are uninsured, people who are on individual health insurance plans, so that means as opposed to a group with like an employer. This is for people who purchase dependent coverage, people with COBRA health coverage, self-employed people with no employees, families, small businesses, and people who have health insurance that is unaffordable. And so there's an exact formula for what's unaffordable. So if you think you might be in that realm, we would have to talk a little bit more because we have to prove that it's more than a certain percentage of your annual income. And they must be a U.S. citizen, visa holder, or permanent resident, some kind of documentation to be able to qualify for the marketplace. So if you already have health insurance through Medicare or Medicaid, you cannot shop in the marketplace. If you are currently incarcerated or undocumented, you also cannot shop in the marketplace. And this is the list of the 10 essential health benefits that the marketplace plans have to cover. And all the plans on the marketplace will cover these. And the ways that they cover them vary, so it doesn't look exactly the same on each plan, but they all have some kind of benefit for this service. The marketplace plan, the plans themselves usually don't cover adult dental. They do cover child dental. But the marketplace also sells separate standalone dental plans. But you do have to buy a health insurance plan to be able to have access to the dental plans on the marketplace. And these are the levels of coverage on the different plans. So catastrophic is going to be, if worst comes to worst, here's this plan for you. It covers about 60%. These tend to be cheap plans, kind of like the bronze plans. They're cheaper on a month-to-month basis. But catastrophic plans are actually available to people under 30, or if you're over 30 and qualify for some kind of exemption to that rule. But you can't get financial assistance to those catastrophic plans because they cover very little, so they don't really help a lot. Bronze plans are going to be a cheaper premium, and you can still get financial assistance with the bronze plans. So if people are looking at these catastrophic plans, I always recommend to look more into the bronze plans because you can still get financial assistance and use that on your bronze premium. Silver, gold, and platinum, you can see how the percentages cover. What those percentages are is that's the average percent of what that health insurance plan will cover for your medical costs. So it's not that every single silver plan is 70-30. It's that in general, over the course of a year, that plan will cover about 70% of your medical costs. And that's that's kind of what that percentage is. It's not that they're all 70-30, 80-20. In Champaign, we've got all the way up to gold, so we don't have any platinum plans in our area.
Excuse me, does this 60, 70, 80, like I know that there should be an out-of-pocket cap that people pay, so if.
We're about to go into that.
Okay.
So yeah, so we'll talk about that. So this is generally like when you're using that plan, it'll cover about that. But then those out-of-pocket maximums, those are gonna be the ceilings. Those are gonna be the final ceilings. So it'll pay about this much, and then if you do hit your ceiling, you won't pay any more after that.
Okay.
The levels of coverage, so those percentages are definitely, think of those as big picture views. The benefits of the actual plans themselves will be very different. So deductibles will be different, co-pays will be different, and co-insurance will be different. The lower the level of the plan, the lower your monthly premium. So bronze and silver are going to be cheaper than gold and platinum. But you're going to have to pay more when you actually go to the doctor on a bronze plan. So all the plans will have a maximum out-of-pocket limit for your protection. If you reach that limit, the health plan has to cover 100% of your costs for the rest of the year. And then all the levels have to cover the 10 essential health benefits. But like I said, they cover those 10 essential health benefits in different ways. And so that's where you get those variations in the metal levels. Catastrophic health plans, like I said, those are for people who are under 30, and if you're over 30 and have received an exemption, you can get a catastrophic plan. So the catastrophic policies have a deductible all the way up to $8,150, but they do cover free preventive benefits. If you buy a catastrophic plan, you can get financial assistance. In Champaign County, we have two carriers, Health Alliance and Blue Cross Blue Shield. For most plans, or for most people, there will be about 17 including the catastrophic, 15 without the catastrophic plans. The average rate of change for the cheapest bronze plan, it has actually decreased. I don't think they've all decreased by 5%, but they've decreased between 0 and 5%. So rates in our area have actually gone down. So these are the market's kind of stabilized now. And like Claudia said earlier, insurance is made affordable in 3 ways. So providing financial assistance, those tax credits can be applied to your monthly premium to reduce the cost that you actually pay. And then this cost sharing reduction part, so that is for a sliver of people who are eligible for also premium tax credits. But the cost sharing reduction makes things like deductibles cheaper and co-pays cheaper. So instead of, if you qualify for cost sharing reductions, maybe your deductible is going to be $5 instead of $25 like it would be for someone who doesn't get cost sharing reductions. So this is just another way on the plan side to reduce your cost for health insurance. And then, go ahead.
What's it called an advanced premium tax credit?
Because the mechanism that they use is the IRS. And so the IRS is saying, we're going to give you a tax credit, but you're getting a tax credit for the month, and you're going to file taxes on it next year, so you're taking it in advance if you want to reduce your premium. You can also take the tax credit later and pay the full price of your premium and get a lump sum when you file your taxes as a tax credit. So technically it's a tax credit, and the mechanism is through the IRS, but you can take it in advance to reduce the cost of the health insurance. But theoretically, you could not take it and get a lump sum at the end of the year when you file your taxes.
Your tax return, like if you got.
Yeah, but if you do the lump sum, it'll be in the following year.
Right.
The actual
It's
cash.
rare, it's less common to do that.
Yeah.
But they call it in advance because you're not taking it later, you're taking it now.
Is there an advantage of taking it?
Well, it reduces
That's
the
probably
premium
outside the
each month.
discussion.
Yeah.
Those are great questions.
Yeah, so the point is, if you're on the marketplace to get financial assistance to make your health insurance cheaper, you want to take it in advance to make your health insurance cheaper.
But some people, if their income is expected to change throughout the year and they don't know exactly what it's gonna be, and they don't wanna end up getting an advance tax credit where then at the end of the year they might have to pay some of it back.
Yes.
They might prefer to take it as a lump sum at the end, so that way they don't have to do a payback if they take more in an advance premium tax credit than what they'd be allowed to. So it just depends on the individual, and I think But the other thing is if your income changes during the year or something.
You can update that.
You can update that as well.
Yeah.
So there's a lot of different ways to, benefit from this, and it's just a very individual decision.
And you had a question too.
If, is the amount of care we get dependent on the level that we get? For example, if I need an MRI, as an example, would it be more likely that that procedure would not be approved on a bronze plan compared to a silver?
No. No, that is not taken into, your medical history is not taken into account, and the, like, maybe these plans have where something needs to be pre-approved, but the metal level will not affect that, the services that you can get. Those are all listed, and they should list, oh, you need a prior authorization for this on this plan. That should already be plainly listed.
But does the decision to authorize, is that based on level?
No.
The metal level is really just, those levels, those percentages are like the actuarial value of the plan. And basically, if you get a cheaper metal, like a bronze, for example, your monthly premium is gonna be less, but that plan will leave you with greater out-of-pocket. So its actuarial value is closer to 60%, whereas if you go with the gold plan, it's gonna cover closer to 80%. You're gonna pay more in premiums, but every time you get care, you're gonna pay less out of pocket. So those are the distinctions. And, you know, there was a gentleman who came to our office yesterday who, he's really healthy, doesn't use a lot of health care, and he decided to go for a bronze plan because it was cheaper every month, and he's sort of, you know, betting that he's really not gonna need a lot of health care during the year, so he's not worried about having to pay more out of pocket if he does need health care, you know, but that's sort of the trade-off. The higher your monthly premiums based on the metal level, the lower your out-of-pocket will be as you go along and get your care. And again, that's another individual decision, but all the plans also do have a total out-of-pocket limit. But it just, you know, so when Adani and Chris work with you, if you're trying to choose a plan, they will ask you to think about, you know, what your health condition is now, how much health care, you know, you use or expect to use, and then you can make your decision based on that and the affordability of the plan.
Thank you.
And this is just a definition of the tax credit, which I think that we've kind of figured out. You can take it in advance, and that tax credit will be paid to the health insurance company, which means that they send you the bill. That's fine, that's reduced. So if you don't take it in advance and you wait to take it later, you would be charged the full price of the bill or a part of the bill, and then you would pay that higher premium every month. The tax credits change every year with the federal poverty level, so the formula that's used to determine what someone's tax credit is going to be, that is adjusted every single year. So even though your income might stay the same, we always encourage people to come back to this because the federal poverty level changes every year, even if your income doesn't. And so you might actually be eligible for more subsidy as the year moves on, even though your income maybe didn't change all that much.
So you're saying that, I'm sorry.
Go ahead.
So you're saying if somebody already has a marketplace plan right now that they
Yes.
signed up for last year and they really like it and kind of want to stick with it, it's still worthwhile to go on the marketplace and update your information because you might end up getting a bigger subsidy based on the formula changing every year.
Correct, because the federal poverty level goes up every year.
Right, and to add to that, conversely, if your household makeup changes,
Yeah.
you might get less of a subsidy
Yes.
if you have fewer people on the plan.
Yes.
So-
Yeah. So anytime changes occur, we try to remind people, here are some of the changes that might happen throughout the year. You can come back at that time. You don't have to wait until open enrollment again.
That's right.
You can go back when that you can go and change this when that change happens. What happens after that? If you can change plans, what happens? That's a little bit more complicated, but we always encourage people to make the changes as they happen.
Yes.
So, jumping way ahead, the subsidy, from what I understand, is based on your, not your adjusted gross, but your,
It's modified adjusted
Modified
gross
adjusted
income
And household makeup.
and household
Yes.
family size.
Oh.
Yeah, and your tax, it's specifically a tax household.
Yeah,
Who you claim as dependents,
right,
married, filed jointly, yeah.
yeah.
And this is a little bit more on the cost sharing reduction. The cost sharing is what consumers pay, so deductibles, copay, co-insurance. It's a discount on those things. So on silver plans specifically, that's where you get a cost sharing reduction.
Where is that reflected on the plan comparisons?
So you wouldn't see it, it would automatically show up. So if you qualify for 250, it'll tell you on your eligibility results that you're eligible for cost sharing reductions on silver plans. So when you look at the list of plans, those silver plans are already going to be reduced. You're going to see that your deductible used to be $7,250 and now it's $2,500. But you're not going to see a difference. It's just going to already be that way.
So it doesn't show if you don't qualify for that.
Right, exactly.
Okay.
So if your eligibility results would tell you if you
Okay.
qualify for that.
Gotcha.
we did it this morning.
Yeah. Excellent.
Now we have more questions.
Yeah, that's right.
Perfect.
Yeah, go ahead.
That's great.
Oh, did you see the laser?
No.
Ooh. Okay. So these are the actual numbers. So here's the nitty gritty. So over here is what we're talking about today is the marketplace. This is the area, the region of income where you qualify for financial assistance in the form of a tax credit. Over here is where you might qualify for Medicaid. So, we can talk about that. Medicaid has its own, there's no wrong door. You could still go to healthcare.gov if you're in this area, but abe.illinois.gov is going to be the direct website for the state of Illinois. Healthcare.gov will send your stuff over. They can't make a decision. They can just say, we think you qualify for Medicaid, but they can't make that decision. So the state of Illinois has to make that decision. And then you can see, we don't have 250 marked here, but it's about 30,000 for one person. So that's kind of what the actual income looks like. And what counts as income? So the modified adjusted gross income includes wages, social security payments and disability, alimony, retirement income, pensions. It does not include child support, gifts, supplemental security income, veterans disability payments, workers' comp, and proceeds from loans. So if you're a student in school, and you've got a loan for books or something, that's not going to be considered income. And to talk a little bit more about Medicaid, one way that it's been made more affordable is expanding it. It's often called the medical card or public aid, and it's health insurance that's offered by the state of Illinois to cover, and it does cover the 10 essential health benefits, and it has no monthly premium. So when we were talking about those percentages of like 60, 70, 80, Medicaid actually has like a 95% actuarial value. So it's a very comprehensive plan, very low out-of-pocket costs. It expanded in 2014, and they don't ask about assets if you're under the age 65. So there's a whole category for adults called the ACA adult category, where they only look at income and they remove the categorical requirements for people to be able to qualify. And so there's that website one more time, abe.illinois.gov. So that's where you could go to apply for Medicaid directly. And here in Illinois, we do have what's called managed care for Medicaid, and so these are just some of the plans that are offered through managed care in Illinois just for Medicaid. And now, if you're getting ready to enroll, we're going to hear from Chris Garcia on what it actually takes to enroll.
Hey everyone. So, this is going to be pretty much if you contacted us for questions about how to get it started or follow up, maybe make some changes if you already did. So, gathering your information. So, like I said, everyone did the same: family size, birthday, social security numbers, and household income. The application, it just depends on what can get verified. There's a background check that gets made, so there'll be some questions. If you get them right, then usually means the IRS and Homeland Security check you off and you're good to go, and you can just go ahead and choose your plan. If there's an inconsistency, they might have to check some stuff, so they might need IDs, and those documents is actually uploaded or mailed directly to them, so we can help with that process as well. If you have a preference to where you get your care, or if you already have an established doctor, prescriptions that you take, these are the questions that Claudia said. Whenever we're in a one-on-one appointment, we're going to ask you about what facilities you go to, what providers, what special needs you might need or have, because every plan is going to be, even though the benefits are going to be the same, the tier of coverage is going to be a little different. So someone who gets a lot of lab work might want a lower deductible because they might meet that sooner, and then that plan kind of kicks into overdrive, and then you really get your money's worth at that point. Or as Claudia said, our client yesterday, pretty healthy, wasn't too concerned about paying for the per appointment, but he did want prescription coverage because he did want that coverage. So there's a lot of plans do that kind of give and take on one end, so lower premiums, but you might have higher out-of-pocket when you actually go for care, and vice versa.
Do you guys help decipher those plans?
Yeah, so in the appointment, we'll sit down and just say, these are the 17 or 15 to 17 plans that you're eligible for. We can compare up to 3. So if maybe there's a good bronze one that you are interested in, and then there's a silver and a gold. So we can do a side-by-side to say deductibles, out-of-pocket maximums, what the actual co-payments or co-insurance are, what the lab and diagnostics, and then the formularies. So we can do pretty much everything. So if you bring or have all those lists already, then we can just go ahead and search. If it's not on there, we can make phone calls. So we just do all the legwork that it takes to really make sure that for the year you're going to be covered.
Right.
So does that calculation also include the subsidies and?
Yeah, so as
that kind of
Adani
stuff?
was saying, the application will automatically do that for you. So if we said you're over income and you don't qualify for subsidies, you'll just see the plan as it is. And then if we open a separate window and put your income and the information, and then it says you're eligible for this much subsidy, then the website will automatically take that into account. So the number that you'll see is your share of what you're going to be paying. So you can know it'll still show you what the plan sticker price is, but then it'll actually just show you what your share is going to be if you applied that tax credit to it. One thing with the tax credits, you can use, like you said, all of it, none of it, or some of it. So someone who's self-employed, who maybe fluctuates, maybe seasonal employment, you might have a peak and then you might have a low. We could check it out, and maybe you're eligible for Medicaid at a certain window, and there's easy ways to transition there. But if you wanted to kind of play it safe, maybe not use the whole tax credit, it does get saved on your account in a way. And then at the end of the year, if things need to get reconciled, maybe you don't pay back as much as you would if you took the whole subsidy and got your estimate wrong.
So Chris, for example, if it looks like they, based on their income and when they're applying, if it looks like they would get a $400 a month subsidy, but they're a little nervous about taking all of that, they could actually choose to take just $200 a month, and then the rest of it, could get saved and then reconciled when they go to save their. So in other words, there's gradations of how much they might take. So they can get the advanced subsidy to lower their monthly premiums, or they can get the lump sum at the end, or they can choose how much per month of the advanced subsidy to take, right?
Yeah, and then if you were to over or underestimate your income and you made more, the amount that you would pay back is also capped. So it's not like you're going to be paying back every single dollar that you borrowed.
Only if you're under 400% of the federal poverty level.
Yeah.
Because at that point,
Yes.
so you have to be within that range. So then at that point, there are going to be caps put in place to say, keep you from having to pay back every single dollar back. And we typically want to adjust it as we go. That's kind of the better way to go about it. But we get it, people are busy, you might not always have time to go into the website and make changes, and you might not be able to guess a new estimate that you might want to put in there. So But there are some safety nets that you can kind of use.
But if your limit goes 400 over the federal poverty limit, your income goes past that, you fall off a cliff.
Yes.
That's
You
the
pay the
problem.
full price of
Yeah.
that plan, period.
Yeah.
Pretty much, yeah.
Well, and one of the things that, I think especially starting last year, that we saw for people who are over 400% of the federal poverty level, a lot of times people in that situation ended up preferring to get an individual plan directly through like Health Alliance or something. So their options could be the marketplace plans without subsidy, or they could go directly to Health Alliance and look at those plans. And for some people who we worked with, they actually were happier with the plans outside of the marketplace because the networks were different, prices were different, and it just met their needs better. So if you're above 400%, you can go marketplace without subsidy, or you can go directly to your health plan and see what they have to offer. Mm-hmm.
How to apply? So there are a few ways. So as Adani said, that through healthcare.gov, it's kind of a no wrong door policy. So you submit your application, put whatever income you expect to have for the following year, and then they'll make a determination based on that. It's in real time, so you'll get a notice of eligibility. It'll say you might be eligible for a subsidy, maybe you're not, or you're low income enough that you are actually probably eligible for Medicaid. So we'll send your info to the state. The state won't quite make a decision right there. They'll probably follow up with you and ask for supporting documentation. So definitely keeping an eye on the mail for a lot of that stuff. You can also do it over the phone through the call center. To get a paper application for healthcare.gov, you have to call for them to send you one. And then in-person enrollment locations, so us. Yeah.
Are these subsidies on a sliding scale? For example, at the beginning of the year, I'm earning 20,000. 6 months later, I'm earning 40,000.
So it's not a sliding, it's, you just want to update that income as you, so like, for example, someone might be unemployed for the first 6 months of the year and they're getting unemployment, but they're looking for work, so then that's going to change. But we know what that unemployment is, and maybe that unemployment already puts them at marketplace eligibility. But so that's going to be our starting point, just so they can get a plan. And then whenever that change happens, maybe they get a part-time job, and then that bumps them into. So we just update it as we go. So it's not a.
Maybe instead of thinking about it in terms of a sliding scale, just think of it in terms of tied to your income and household size. So, the lower income, the higher the subsidy, but as the income goes up, the subsidy may not be as generous.
Yeah, I'll be coming in for individual consultation. Basically, 9 years ago, I had a major stroke, and I've been through several brain surgeries. And every year I have diagnostic tests, MRIs and so forth, that run 12 to 20,000 a year, and that's just diagnostics alone. That's not.
That's important to understand when you're looking at plans.
But
and looking at
I'm on Medicaid right now, but I'm trying to get back to work, and so my income's going to get me off of Medicaid and into something, and then at another level, I'll be falling off the cliff, as he said.
So we would be projecting your income for a whole year. So whenever your change happens that gets you off of Medicaid, that would be a special enrollment period.
Right, I understand.
And then we would take a good guess. It would be a guess though, right? But we would project for all of 2020.
But I'm trying to
what your
figure out,
income-
starting a new business, how much do I need to be earning and saving up before I hit that change point? And then how much more do I need to be earning and saving before I hit that second change point down the road? And so this gets complicated.
It's definitely very complicated.
Yeah, and healthcare.gov, what we would do in our individual appointment is go through healthcare.gov and we would do your points, the points that you've chosen, and we would put those into lower cost, or we would use the tools on healthcare.gov, because they have a preview tool. So we can use the income and then kind of preview how much of a subsidy that would be. Because it is a complicated formula. It's not a direct scale.
So this is what I'm trying to do, if I'm trying to get myself out of a financial hole.
Right.
And actually, but what I'm concerned about is I might be making more money on paper, but if it's all swallowed up by health care, it's not going to make a difference.
Yeah. Understandable.
Can I ask, is the preview tool available to those that are individuals online trying
Yeah.
to?
Yeah.
Actually,
Oh, yeah.
the link is right there.
So that's the link for the
Yeah.
tool, and I think when you
Okay.
just get onto the website, it says like enroll or apply, and then say, you can type in preview plans, and the first result is usually that one.
Thank you.
It'll ask you for age, household, and income.
Yeah.
So like just the simple stuff, and then it'll give you pretty much, it's usually really good at calculating what the subsidy is going to be. And then you can kind of preview that way as opposed to like going through a full application.
Is it basically real time though? I mean, you can change it?
Yep, right away. So like, so in that case, we would say, oh, maybe we estimate
Okay.
25,000 the first like few months, and then maybe if we jumped to 35, then we would know what that subsidy gap is going to be.
That's good
So
to
how
know.
much you would have to be able to pay more
Sure.
for that same plan or for a different plan.
It's very helpful.
So again, where you can go to get enrollment assistance. So we can do both Medicaid and Marketplace. So if you're unsure, we can do both of those. If you've already got an eligibility, you can bring that to an appointment and we can figure out what next steps to make.
So, I'm sorry, Kara and I are from Piatt County?
That's
You guys
okay.
take Piatt County?
That's okay,
Yeah.
Not too big.
It's our name, you know,
Yeah.
we're not a government agency, so it's just in our name, but we're happy to,
Okay.
we're neighbors, so
Thank you.
it's fine.
Appreciate that. Thank you.
So then just 5 steps to renew your coverage. So again, as Adani said, even though not a lot might change in your income, the federal poverty level brackets change and shift. And so the Marketplace does allow you to use that same info that you put the first time around for 5 years. So if you just didn't want to touch it, it'll keep it for 5 years. You might be missing out on some subsidies, so that's why we always try and get people to just log back in, check what the new amounts you might be eligible for. Again, plans change, so even if you really liked your plan, it might get discontinued next year. Usually the insurance company is supposed to send you a notice to say, hey, we're no longer going to offer this plan. On the account itself, it will generate a plan that's close to what you had. So you can say, well, we can compare it, and if it's something similar, you can keep it, or just shop with the new options that are available as well. So yeah, so keeping your notices and your like summary of benefits, things like that, so to have that. Updating, comparing plans, and choosing the best one that meets your needs. So everything from the premium to cost sharing to what the subsidy, how much of the subsidy you want to use, network, and formularies. And then again, 2020 coverage for January 1st start, you need to sign up by December 15th. For the documentation part, if something doesn't match up right away, they'll still let you go ahead and choose your plan. And then you get about a 60-day window to provide that additional documentation. So there's a grace period, so we can figure out what documents are needed. If you disagree with the eligibility determination, there is an appeal process. So if for some reason, maybe the website's being glitchy, or we kind of notice that it's not quite what it maybe should be, or when you don't agree with the eligibility, we can go ahead and appeal that eligibility notice to get it reviewed, to see if maybe you're eligible for more. I think you can call over the phone and do an appeal over the phone. We have all the forms for hardships and just appealing all that stuff as well. So if you just wanted a hard copy, we can do that. And then when you get an eligibility, there is, I can't remember what page it is, but there's a barcode. It's got your application ID on there, and that's how they match your accounts. So make sure to keep those eligibility notices because you might need them.
Does that change when you have a change in your household or in your?
So yeah, if you made a change, then it's a new application ID that gets created for.
Even within the year?
Yeah.
Not
pretty-
within
not
the
within the
year.
year, okay.
Now,
So
as long
just-
as it's the same year, it'll still be the same application ID number.
So they can amend it but using that same number?
Because it'll still be your
Yes.
same account,
Okay.
yeah.
Okay.
Yeah.
Yeah,
But
you're
if
just reporting a change, making a change.
Okay,
Yeah.
okay, thanks.
So year to year, it will be a different application.
Okay, thanks.
And then exemptions from the individual responsibility payments. So The major change, starting 2019, is that the individual mandate is still in the picture, it's just been reduced to 0. So it's just not being enforced. So,
Yeah, you'll hear people say, oh, it's been repealed. It hasn't been repealed, it still exists, in law, but functionally, it's gone, because it's 0 penalty.
so the IRS is no longer enforcing that penalty. So if you went more than 2 months this, or in any year since like 2019 and on, unless something changes, they're not enforcing that 2-month gap anymore. So, the key thing to remember though is if you are wanting to get onto the marketplace, and if you're transitioning from Medicaid or any other insurance, you still only have a 60-day window. So you won't get penalized if you go longer, but then you can't get on the marketplace because you've missed that window.
I was reading where the expected contribution is for the 400, if you're at the 400 FPL, is 9.78% of your salary or your income.
Your income.
Is that?
I'm not sure exactly on the formula. So that is for if your employer coverage, for if that premium is more than 9.78, then it's considered unaffordable.
And then you can.
And then you can opt out.
Oh.
Yeah, so this is
Yeah.
opting out of other employer
Okay.
coverage.
Because some employers
Well, that's clear as
save
mud.
money, yeah, but they jack up the price of their own to be able to basically.
Yeah.
Yeah, so most employers have what's within the affordable range.
Yeah.
If you have questions about it and you are not sure, then we can go ahead and there's a tool that you would get from like your HR department. They would fill it out with what the estimate plan cost for that would be. We send it to the marketplace. They do their work on their end, figure out. So they would probably call the employer and do a bunch of legwork. And if they said, yeah, okay, this is unaffordable, then they would grant you a special enrollment to get on the marketplace and get the subsidies. So you can always waive your employer coverage, but then you're not going to get the subsidies unless you can prove that it's considered unaffordable.
And that's how you do it.
And that's how you do it, through
Got it.
going through that tool and providing those documentations.
Okay, good to know.
So, good for
Hardships and exemptions. So if you are facing eviction, have been homeless for part or the whole year, receive a shut-off notice, domestic violence, bankruptcy. So there are ways to get out of having insurance. Again, the mandate isn't being enforced, so we're not quite sure how that's like working out right now, but definitely we can do the hardship exemption just to kind of cover the base to make sure you've done all the steps that you need to do to not get in trouble later on.
But really, we want people to be covered, so a lot of these factors, if somebody has to leave the marketplace, we would just try to get them into Medicaid.
Yeah, so in general, we would do an exemption to maybe try and do troubleshoot to get a special enrollment somehow, or to try and get someone on Medicaid if that's what they're eligible for. So again, applying for exceptions, you can go on the website, you can call them for the forms, or you can contact us and we've got those as well. So the ACA going forward, there's a few things we just wanted to pinpoint. To this day, folks are still trying to fight Medicaid and the ACA, so as Claudia said, the mandate is still there, so people might say it's being repealed, but it's not. The law stands as it is, it's just that portion that's been reduced to 0. There are work requirements that are trying to be enforced state by state. So far, Illinois has been pretty good about that. But there are still issues with expanding Medicaid. So other states are still struggling with that. And then public charge is another thing that has been coming out through, not law, but just through like administrative enforcement rulemaking. And what it's done essentially is, for example, folks that are permanent residents and on visas, they are being kind of bullied out of being given the option to sign up for coverage, even though they are eligible, but there are threats of like, if you're aiming for citizenship, that might be a barrier for you. And again, threats to the ACA, so it's November 1st to December 15th, but it's closed on Sundays, so you can't do anything on Sundays. So that takes away a few Sundays out of the week, so you're out of the month, so you're actually less than 45 days. I think it's like
It's like
38.
39 days.
Yeah.
So it used to be 90 days,
Mhm.
and then under the current administration, it went down to 45 days, but then with this maintenance, it's really down to 39 days. So a lot of people end up scrambling.
And that's actually, so I was reading, I think California was able to expand theirs again back to like 60 or 90 days.
Oh, wow, yeah.
And that's because they have their own marketplace. So Illinois has a federal state partnership, so we depend on the federal website to apply. Other states created their own state-based ones, so a little more flexibility there. And then the last thing we wanted to mention is the short-term plans. So this is something that we see every year. Folks go online and they search health insurance and they come up with some random companies. Might sound familiar, might look really good, but those are just very like strict plans. They're pretty much gonna sell you on like the immediate stuff, so like your primary care maybe, but then there's caps on coverage for stuff like that. It might not have maternity, it might not have prescription coverage. It's gonna be strict. On the phone, it'll sound really affordable because they're pretty much targeting what you are really wanting, but you never know what you're gonna need throughout the year. So those 10 essential benefits are not gonna be standard. So you might get left out because of a pre-existing condition. If you have a short-term plan throughout the year, and then you figure out that you're paying for nothing, you don't just get the option to get onto Marketplace. If you voluntarily turn or cancel your policy, it doesn't grant you a special enrollment. So that's why we definitely want to avoid those, because it might sound good for the first few months, you're not using it, something happens, and then you're kind of out of luck because you can't get on the Marketplace, you're stuck with a crappy plan that you cancel and then you're uninsured. Unless you're within Medicaid range, then we can do something, but yeah, so just kind of keeping an eye out on a lot of the mail that you get and infomercials and stuff like that. Healthcare.gov is the only place where you can get the subsidies and then where it's like actually being regulated. And
So in terms of, thank you, Chris, in terms of what you can do to help, we just wanted to let you know that, those of you in this room right now, you know more than most of the people outside of this room. You know that there is a marketplace, you know that there's health insurance plans, that you can qualify for financial assistance. You know also about Medicaid, you know about healthcare consumers and that we can help people. So, you know, if there are other people in your life or in your circles who need help, you are in a position to help guide them, share materials, or direct them to us. It's really important to help spread the word. Under the current administration, the outreach and education budget has been slashed. And so we're actually now starting to see the numbers of uninsured go up, including for children, because a lot of times people just don't know. And if they miss the open enrollment period, they're out of luck a lot of times. So we just wanted to let you know you're sort of, you know, right now a very well-informed group of people who know more than probably your neighbors and friends and so on. So you can just help spread the word. So I think we're, I'm trying to figure out which direction. So I think we're pretty much done with the formal part of the presentation. Again, here are some resources. We should have taken that off. Don't worry about Get Covered Illinois. That's through the state. And as Chris and Adani said, it's just better just to go through healthcare.gov, or if you know you qualify for Medicaid, go directly to aid.illinois.gov. And again, healthcare.gov, this is where you can look at the estimates, and you can always contact us. So that's it. We're happy to take questions.
Yeah, just on this one before you take it. web pages, there's no www.
Oh, you're right.
Illinois, or,
Yeah, it'll come up. Yeah, it'll
Okay.
work. Yeah, it'll work.
right.
Yeah. But I never noticed that, you're right. Yeah. Any, question? Yeah. Okay, how about you?
Take this scenario, say you're eligible for Medicaid, but then during the year, you get a much better job, and so your income will take you outside that range. What happens? I mean,
So when you would update your income information with Medicaid first, because depending on the income, you might still qualify for Medicaid. If you update your income with them and they say, okay, you make too much for Medicaid, here's your termination letter, we're gonna terminate you in 30 days or at the end of the month. And so with that letter, that is your documentation that opens the door for your special enrollment to the marketplace.
okay.
Unless you're being offered, I mean, we'll see, depending on the situation, ideally you would just go to the special enrollment period on healthcare.gov, but if you're being offered insurance at a job, that complicates it a little bit more, so you might not be able to get financial assistance. Even if you can get to healthcare.gov, you might not get financial assistance if you're being offered health insurance from an employer.
And we would recommend, if you know this change is gonna happen or it's happening, for you to be proactive rather than waiting for the state to catch up on the information, because by the time they catch up, if your new job doesn't offer you health insurance and you wanted the marketplace, you might not have a very big window to enroll through a special enrollment period. So it's really good to be proactive if that change happens, and if it does, we can always help you do all of that.
Okay.
That was a good question.
Okay.
So, earlier you said that, if your income is above the 400% level, you can get, health plans directly from health insurance companies. But can you still go through the marketplace if you're above 400%?
Yeah, you can. You can definitely do that, but at that point, then I would still encourage you to look at those, but then also look at the ones, like let's say you're interested in a Health Alliance plan. You can look on the marketplace, but I would also encourage you to look directly at the, individual plans that Health Alliance offers, because the networks are sometimes different. What's on the marketplace for Health Alliance network might be different than what some of the individual plans are. So we just found a few people who were actually just better off going directly to Health Alliance and getting a plan that way.
I don't understand the benchmark of a silver plan.
So those are meant for the formula. So like you don't have to worry about the benchmark you would worry about the benchmark when you're filing your taxes, because these are the formulas that they use to create the prices for the plan. So these are actuarial. The silver benchmark plan is like, okay, so this is the price of the plan, and they fine tune the subsidies based on that benchmark plan. So what's the price in this area? It's X, Y, and Z. All right, so X, Y, and Z squared plus times divided by what the expected ratio is. That's the subsidy that we give. That's the formula for the subsidy for everyone. Does that make sense? Like you don't have to worry. Why are you looking at the benchmark plan?
I just worry about anything else.
So that's a back end like idea. That's a back end concept, because they're using the benchmark plan that's where they plug it into the formula for the tax credit. So it's like a variable.
I was just trying to figure in my head, how do you know at the back end how much you did or did not save in the marketplace?
Oh, so you're trying to kind of retrofit.
So I can tell whether or not I should go do X, Y, Z or not.
Or skip the marketplace and go directly to the company, like talk to plans that don't come to the company. I mean, just to see if it's.
You can always do that.
Yeah, so you don't have, it doesn't have to be the benchmark plan is just used to figure out subsidies. So what you can do, if y'all want to bear with me, we can try to go online and see if we can look at the tool right now. Do you want to try to do that, or is that good?
Do the what?
Use the tool? The tool, look at the tool. Sure. So you can look at the plans online, and you can actually just see what the sticker price is on healthcare.gov.
The other, while Adani's doing that, the other definition of benchmark is that, the federal government says, the plans have to have 10 essential health benefits. but you still have an Illinois Department of Insurance that is in charge of all of the health insurance plans in the state of Illinois. And the 10 essential health benefits and how they're covered and what all is covered within them may vary between, Illinois and Indiana, et cetera. And so that's another benchmarking, is that when they were figuring out what the 10 essential health benefits would look like in the state of Illinois, they literally picked certain Blue Cross Blue Shield and other kinds of plans, and they said, this is the benchmark, and so any plan offered in the state can only vary a little bit from this. So that's the other definition of benchmark as well.
That's what I was looking at.
Oh, okay.
That's what I was looking at. It's like,
Yeah.
how do I know what that is?
Yeah, it's
No.
sort of like the state of Illinois says, here's the standard. There's gonna be some variations, but
Okay.
yeah,
I got it.
okay.
So I put in the age 40-year-old female, and I did not put any income in, so it is not giving me any subsidy. So these are the full prices for the different plans. It's gonna give you the plans in premium order. So this is the cheapest plan without a subsidy. It's a bronze plan. You can see over here they have star ratings. Most of ours are gonna be the same. They're all like 3 stars. And so you can see here's your deductible. Like all of these here, no charge after deductible. What that means is that it will be free after you spend $6,750 in medical services. Does that make sense?
So lower monthly premium, higher out-of-pocket cost.
And so
Total
that's the
maximum.
same, so the deductible and the out-of-pocket maximum are the same. So that's why after you reach this number, everything is free.
So if you choose this plan, you're somebody who, let's say you have health issues, and you might anticipate that you're gonna be needing to use health care a lot during the year. Financially budgeting, you should plan on spending that times 12, that's your monthly premium, that times 12, plus up to $6,750.
Could you redo that for a 60-year-old? Because I did just a look the other day, not here but elsewhere, and it was like $1,600 a month or something.
Oh yeah, it's very different when you're,
If you're 60.
yes, that is the final age band for these plans. So you're in the highest realm.
I mean, I just couldn't believe it.
So yeah, this is a bronze plan, so this is the cheapest. This is the cheapest plan without a subsidy.
It's age, location, and income.
Yeah, I just skipped the income for
So
now.
those are the 3 things that they use to kind of figure out what you're gonna get, so. And 60 is like at the cutoff before you're technically gonna go to Medicare,
Well, that's
so.
cheaper than what I was seeing online. I was seeing like $1,600 online where I was looking around.
Yeah, and I mean this is just bronze, right? So when we move up, it's already getting there.
Yeah. So this is the sticker price without any, financial assistance.
Yeah, like I was estimating like 25,000 with premiums and out of pocket, and it's just like, that's real sticker shock.
Yeah.
And then once I get above that 400% level, it's even worse. You know, just
Yeah, you got to weigh whether or not you want to go above 400 stuff,
Yeah.
I got away whether I want to get above.
Well,
Right.
there's things you can't change, but I mean, if somebody's really close to that number, then it might be worth not even working for
Well,
2
this
months
is
or
the
3
thing.
months.
Where I'm at now is I would like to get off of Medicaid. I'd like to get my life back, and I can't because this is what's stopping me. So I've been getting advice about setting up a small business, and some of the coaches that I've been talking with, the small business coaches, say set up an LLC and let the LLC reinvest income until you get to a certain threshold, and then they can pay you as an employee. And so your money is saved up over here, but it doesn't show up on your individual plan until you're ready. So we were trying to figure out that kind of a scenario. We're trying to play a game to see if that
Yeah,
could be
self-employed and small business, self-employed stuff can get really pretty complicated for all those reasons, so.
But I've got some tax experts telling me that might be possible.
Yeah, but anyway, so these are, this is what that tool looks like, and Adani didn't put in, income,
Right.
so,
This is just a straightforward.
yeah.
So this is like a maximum.
Do you wanna just, maybe add in an income?
Yeah, I was
and
gonna
let's
add an
see-
income, it's just super slow, I'm sorry.
No, that's okay. Let's do like,
I was interested in like 30K and 60K. That gets
All right,
me
let's do
halfway.
like 30,000.
I looked at this and it came up saying something about like, there's a deductible and a fee, a percentage that you pay if you go to the ER, and I didn't know what that meant. It said something like after deductible,
Yeah.
then 40%, and I wasn't sure if they meant paying the deductible above on that screen, and then, which was like, I don't know, $3,500, I think, and then it said 40% after that.
So, the deductible is that chunk of money out of pocket that you pay before your insurance really fully kicks in.
Right.
So if it's telling you, after deductible,
Like right where it says, you see where it says 6750?
uh,
Down below that where it says no charge after deductible under emergency room care. The plans I looked
So it would
at,
say a number or something.
it would have a percentage
Yeah.
number, like, or like
Yeah.
40%.
So what
or
that means
30%.
is that you have to reach the deductible first before it's discounted. So you have to pay $5,000. If you go to the emergency room and your bill is $5,000, you paid your deductible, and now next time you're gonna pay 20% of that bill, of whatever the bill
Or
is.
it was 40%, but sure.
Yeah,
I understand.
this is co-insurance as opposed to co-pay. And the thing that personally makes me a little nervous about co-insurance is it's a percentage of the total cost, and we never know what the total cost is gonna be.
Right.
So, so it can be a little nerve wracking, but then that's where your out-of-pocket maximum comes in. Your out-of-pocket maximum, that's inclusive of the deductible.
Correct.
So, so after, you meet the $5,000 deductible, then you're responsible for this co-insurance. It's like before there were a lot of HMOs and all that. Some of us are old enough to remember when it used to be sort of standard like Blue Cross Blue Shield, and it was like an 80-20 plan. The 20% refers to like this, 20% of the bill, but that's nerve-wracking because you never know what it's gonna be.
Right. Well, you also don't know what counts toward your deductible because they have negotiated rates with different providers.
Right.
And that part is always a mystery, and I kept thinking, I've been to the doctor multiple times, I've had
Right.
these tests, I've had,
Yeah, I
minor
should be
surgery, I
racking this up.
should be there, and
Yeah.
it says they only have $124. I'm like, what is
Yeah.
that? You know?
Yeah, it
But
is.
they cover things you don't think they cover.
Right,
Yeah,
that's true.
That can be really confusing.
It's just kind of always a mystery, so
Yeah.
that sounds like it would be good if it's a lower deductible and you're paying a little more each month.
Yeah.
But.
So for people who are 400% or more of the federal poverty level, if there's a plan like this on the marketplace with co-insurance and all that, let's say, Health Alliance or whatever, they might actually prefer to go to a direct Health Alliance individual plan, maybe get a HMO where you have co-pays instead of the co-insurance. That way you have a flat rate, if you go to the emergency room, it's a $200 copay. If you go to the doctor, it's a $25 copay, or whatever, whatever it is.
So co-insurance isn't the same as co-pay?
Correct.
It's like a percent as opposed to a flat rate.
Yeah, co-insurance is a percent, copay is a
copay.
specific dollar amount.
Yeah, so this is a copay on the first day of your health insurance, on the first day of your health insurance, if you go pick up a generic drug, it's gonna be $10 for your monthly prescription. However, if you go to the emergency room, whenever you see this percentage, you should immediately think, what's my deductible? Because so if your deductible is $5,000 and you haven't met that on the first day of your health insurance, you might have to pay up to, whatever that emergency room bill is. You don't have to pay $5,000, but you have to pay the emergency room bill. If it's $1,300, you've now deducted $1,300 from your deductible. And so once you hit this for the year, then you can start looking, oh, I pay 50%, I pay 50% of the primary care up until your out-of-pocket maximum, which is the most that you would pay for covered services in network.
These still feel like kind of big
Is that
dollar
clear?
amounts to me.
They are.
They are.
Yeah, one of the things that we were, one of the things before the 2016 elections, the marketplace had been around for a few years, and those of us who are advocates and working with people all the time and sort of seeing the plans that are offered, the financial amounts and all that, one of the things that we really were eager to work on was to try to change the definition of affordable, in the marketplace, because really, I mean, this is, some of this is pretty pricey, really, if you're paying out of pocket, and, but even before the Affordable Care Act was implemented, insurance was moving in this direction of like higher deductible plans, more co-insurance, and that was a trend that we really didn't like. That was a change, and that's insurance companies sort of doing more cost sharing, which means you're paying more of the cost.
This is a silver plan, and with the income that we put in, we qualified for cost sharing reductions, and this is kind of how it's signaled, extra savings. And so maybe the primary care doctor was $25 previously, but now it's $10, and maybe the deductible was $2,500, but now it's $1,000. So this is going to be that yellow. That's what's going to signal that you're getting cost sharing reductions, but you're not going to see it like here.
So you entered a low income, that's why this came up?
I entered under 250% of the federal poverty.
30,000.
Yeah, and it shows you that it includes the premium tax, advanced tax credit there of $948.45.
And then there's the sticker price.
There's a sticker price. So really, for the cost sharing, for the people who qualify for that, who are in that narrow income range and who qualify for that, the silver plan with the cost savings can really become the equivalent of a gold plan, because it's going from covering 70% to closer to 80%. So it sort of increases the actuarial value of your health plan by reducing your out-of-pocket expenses. But that's for that narrow, what's the income?
250%. So it's between the 138 and 250%. So you're eligible for a tax credit, not quite eligible for Medicaid. So between, Medicaid eligibility and 250%. Any other questions?
Any other questions?
On the Medicaid, if you're not working, can you get a health plan through Medicaid?
Yes, and the nice thing about Medicaid is it's open year-round. There's not an open enrollment period, so there's not a narrow window. You can apply anytime, I actually really love Medicaid because it's, how there's the metal levels like bronze, silver, gold, platinum. It's better than platinum in terms of its actuarial value. There's very little out-of-pocket expense. There's no monthly premium. There's no deductible. The co-pays are very low to non-existent, including for prescription drugs. And then in the state of Illinois, what they've done with the Medicaid program is moved into Medicaid managed care. So once you qualify for Medicaid, you would get a notice saying, okay, now you get to pick a Medicaid managed care plan, and there's like 4 of them or so that work in this area in terms of the networks and stuff, and they might have additional benefits to the plan and to coverage beyond what traditional Medicaid offered. So they might have more coverage for vision and for dental than if you were just on straight Medicaid. So I actually really I think it's a fantastic, benefit for people. So I was really happy that the state of Illinois expanded Medicaid. My home state, and Adani's also of Texas, has not done that. And my family down in Texas would have really benefited from it. Yeah.
But I can say about the Medicaid plans, if you don't mind popping in, that when they give you the choices of those plans, the first thing you want to do is, if you have doctors you want to continue to see, ask them which one they accept. They
Yes.
don't accept all of them.
Yeah.
So you might be seeing a doctor who only accepts Molina, but you know, if you don't choose that,
Right.
they're gonna just offer you one and just say,
Yeah.
here, we signed you up for this because you
Yeah,
didn't
the-
respond.
Yeah, they'll auto-assign you,
Right.
and unfortunately, the state, although they claim that they had some big fancy algorithm that would know to assign you to a health plan that works in this area, that's BS, it doesn't work. So it's really important, like you said, to be proactive, and we can help people with that also, to choose a plan. And then the other thing that's really important is the prescriptions also, especially if you take certain types of inhalers or other kinds of medications, the plans, just like plans on the marketplace, they'll have different formularies. But so we can work with people on that as well to make sure they choose a good plan.
Yeah. I'm on Medicaid and I go to Carl, and Carl, if you're on Medicaid, you automatically qualify for their financial assistance program at 100%.
Yeah, it's beautiful.
So anything that Medicaid doesn't cover gets covered 100% by Carl.
Yeah,
And if there's anything Medicaid should ever refuse to authorize, Carl kicks in and they automatically cover it, no question.
yeah,
If the doctor requests it, as far as the community care or financial assistance program is, they cover it.
thank you for bringing that up. Carl
So
has
100% coverage for 100% of everything.
Carl has done an amazing job with their financial assistance program. So now they auto enroll people into the financial assistance program. So like you said, if you're a patient there and you have you have Medicaid, they'll automatically sort of apply you and enroll you. And then you have total coverage, and I'm actually really proud of Carl for that, and I'm proud of healthcare consumers for that, because we worked with them for years and years to advance the financial assistance program, to make it very user-friendly and minimize the amount of paperwork that people have to do to learn about it and then to apply for it and all that. So that's a really good point. Thank you for bringing that up. That's another good benefit.
I think you have to renew that each
Yes.
year.
It's every year.
It's a
Yes.
short little paper.
Well, all I
Yeah.
have to do is tell the patient accounts that I've re-qualified for Medicaid, and they just do it from there.
Yeah, and the nice thing is, even if you miss your renewal, like if you have a gap in between, once you qualify again, they'll go back and zero out your account.
Yeah.
So it's retroactive. So it's really, from a national perspective, it's really a model financial assistance program. It's beautiful.
And even if you're above the poverty level, up to a certain amount, you're on a sliding scale with their financial assistance program as well. It's
Yep.
very nice.
So, we can take a couple more questions, but I wanted to make sure to point out the packets and some information that you have. This is just like a little cheat sheet for getting ready and what you need. This green handout is really helpful because it's got those income charts on there. So this is another way that you can be a resource for somebody else. There are a lot of people who still believe that they cannot afford health insurance, because it wasn't that long ago that many of us couldn't afford health insurance, especially if we had to try to buy a private plan. But this is really a game changer. So you can help spread the word, and you can even help people look themselves up and see what they might qualify for. And then we just have a little handout on the short-term plans, because those have been in the news a lot lately, and they're helpful for some people, but they have really serious limitations, and people need to know what they're getting in for. Any other questions? Okay, if not, we'll stop. You can talk to us individually, eat more snacks, take off, whatever you want to do. Or you can talk to Chris and Adani if you want to if people want to schedule appointments. Can they talk to y'all? Yep. Okay, so they have their schedule with them, so if people want to schedule appointments, you can talk to them.
Thank you.
Thank you very much. Thanks for all the great questions.
Thank you. Good job.
Thank you. What an informed